The optical clinic setup is very important so that you'll be able to have a smooth flowing clinic and also get accurate readings from the autorefractor. In tab 8 of your training manual, you will see this document. And this gives the steps for setting up an optical clinic. So if you scroll on down, you will see a layout diagram. And this is a 20 by 25 foot layout diagram. Obviously, you don't have any specific control of the size of the room that you get, but you do want to have it lightly or dimly lit so that the patient's eyes will not be restricted, the pupils will not be small, and also so that the autorefractor will get accurate readings. You do not want any direct sunlight shining into the autorefractor. So I always make sure that neither the patient's eyes nor the autorefractor are looking toward the sun when I'm measuring them. On the right-hand side, you will see a row. These are chairs with patients waiting to get into the door. You'll have the translator standing at the door, and they will ask the individuals as they come in their age. They'll also put either an armband that's a sequentially numbered armband that's going to have the person number on them, or patient number, and on that armband they will write that age. Another way is to get a clipboard and get a roll of 1.5 inch wide masking tape and tear off about 8 strips about 2 inches long and put them on that clipboard. And then with a Sharpie, label those left side of those strips with 1, 2, 3, 4, 5, 6, 7, 8. And that's going to be the patient number. And as you use them up, you do 9, 10, and so forth. Now, so therefore, what you'll do is, when you know the patient's age, in this case, you'll write the age on the right-hand side of one of those strips, and you'll slap it onto the patient's shirt or at the top of the patient's shirt or blouse. And then with their age, if the patient is 20 and below, and you know they need glasses, you're going to have to dilate them. And now in tab number 1, page 23 of your training manual is your recommended dilation fluids that you can get through an optometrist or through a pharmacist or a medical doctor can get them also. But at any rate, you're going to have to dilate everybody that is 20 years and below, 100% of those, or you will not get an accurate reading from the autorefractor. So what I do with the younger patients is I have them to stand right here behind a toe line, tape on the floor, and look at the E-chart across the room. Now, if they can see 20/20 or 20/30 on the E-chart, they will not need glasses. Now, sometimes a child will stand across the toe line and look at the E-chart and say they cannot see anything. Now, they may or may not be telling the truth. What I do is I carry with me some clear glass glasses, and I put these glasses on the child's face and ask him or her if they can now see clearly. If they say they can see clearly with these clear glass glasses, then I know that they're lying, and I'll give them some children's sunglasses, or I'll give them a little trinket or toy that I get at Dollar Tree or so forth. I don't chastise them, because all they're wanting is a toy, and every child needs a toy. But if they truly do have a vision issue, you're going to have to dilate them and then place them in the dilation waiting area. In the dilation waiting area, I will hand them post-it notes where I have written the time that I dilated them. And that way I don't have to remember when I dilate them, because you're going to wait 15 minutes for the dilation fluid to take effect. And then when the 15 minutes has expired, you're going to flash a pen light, and one of those is in the optical kit. Flash a pen light into their eyes and see if their pupils move. If their pupils change at all in size, then they're not fully dilated, and I say wait 5 more minutes. Now, I've had to wait up to 25 minutes. Very rare. Most of the time, 15 minutes is more than enough. Okay, at that point, whenever they fully dilated, I'll test them. Now, between 30 and 40, between 20 and 30, or 21 and 30, you may need to dilate them also. But if you're pressed for time, I may test them twice and compare that first number of the prescription on the right or the left and the left eye. If that first number, which is the Spear number, is greater than 0.5 difference between the two readings of the right and the left eye, then I will dilate them. Otherwise, I'll take the readings. If it's greater than 0.25, 0.5. So that's really important. If you don't dilate a young person, the autorefractor readings will be useless. Okay, now as soon as you have a patient waiting, ready to be tested, you're going to have us sit here. Of course, in addition to getting your age, you will ask the patient the nature of their problem. If they say they could see fine at a distance, but not up close, then you're going to send them to the reading table, and you're going to test them with the reading chart, which I'll discuss later. And you're not going to bother to dilate them or test them with the autorefractor if they say they can't see fine. Now, if they're unsure, then check them with the acuity chart, the E chart over here, and find out if they can see well. If they can't see between the 20 and 20 or 20-30 lines, there's a green and a red line across the bottom of the E chart, then you'll want to test them. Now, here is where the patient will sit when he or she is being tested. It's either across a narrow board or a narrow table, or sometimes I have to do it across the corner of the main table. So the patient's sitting here, and I'm sitting here, and I'm measuring the patient's eyes. Now here's where the PC is placed. That's the autorefractor, PC, and that's a small printer. This is a table used for repairing glasses. Repairing glasses, or maybe you keep your supply of readers, sunglasses there. This is the storage area where you're storing all your glasses. And you put your empty boxes over the ends here, and keep an eye on them to make sure that they don't grow legs and go someplace. Because you'll leave those boxes to repack your glasses whenever you leave. So this is a table where you put the charging rack for the batteries. Windows are normally blocked with something because you don't want any direct sunlight. So with this optical clinic layout and following the procedure that I described, you should do fine. One other thing to mention is that keep the number of the people in the clinic down to 6 or less. If you have too many people, especially children, things will start disappearing. So be sure you keep the number of the people in the clinic down to be 6 or less.